Okay, today we're going to discuss the treatment plan for Maria. She came into the office saying that she was feeling stuck, lethargic, joyless. She feels like she's just going through the motions. She doesn't feel happy in her life. She has a hard time getting out of bed. And so, based on what she was telling me, I had her do the DASS self assessment. And based on the assessment results, she ranked high in depression, low in anxiety, and mild in stress. Uh, with that, I asked her a few more questions to kind of get a little understanding of a little bit more what's going on. Maybe if she was taking other medicines, kind of speaking a little bit more on the biology element of it. If she was on any medicines, if there was what is her caffeine intake? Does she drink a lot of sodas every day? What is her alcohol? Does she drink alcohol? If she does, what's the extent of it? Which in all those cases, she didn't say she was a moderate caffeine drinker. She doesn't drink alcohol, and she's not on currently any medicine. I did ask if there was, since she's had previous experiences with depression, that helped her make it known that she needed help. And she came in, she noticed that she'd been gaining weight in the last year, and just recently her symptoms seemed to be getting worse. She remembered it happening when she was 14, and she was put on medicine. And then she also remembers it happened again in college, which was about 10 years ago. So it hasn't happened since then, she says. But I asked about family history, if maybe depression runs in her family, or if somebody in her immediate family experienced similar situation. She said that her mom, when her mom was pregnant with her, or after she had her youngest brother, that she kind of went through a depression too. So with that, and I asked more questions on too her spiritual, social components. How does she feel connected with her church? I know she had mentioned that she had went to church, that she was a Christian. She feels that she does not feel supported at church, that she has to put on a front. She's afraid that her church members might judge her. So she always feels like she has to pretend that she's something that she's not, because she thinks that she may be judged. She doesn't feel very close, and she's not as connected in church as she would like to be. Based on she's afraid that they're going to find out that something's not right, as she said. So with that, she was diagnosed. I diagnosed her as major depressive disorder with moderate single episode. Single episode being that she hasn't had one since she was in college. Moderate, she didn't seem, based on her mental health checklist, she didn't seem to be as severe. With she didn't have suicidal thoughts. She wasn't breaking down and crying. She wasn't incoherent. She understood that she needed help, so she took it upon herself to come in for help on her own. She was very open, straightforward. She looked well dressed, so she was still taking care of herself. She hadn't let that go. So it shows that it could get worse if she doesn't get the help, which is why she was in. She did show she met 5 criteria that would be in that diagnosis, which was her depressed mood, her diminished interest in things that she enjoys, such as running, her weight gain. She's gained some weight because she just doesn't feel up to doing anything, and she craves sugar. So she's been craving these bad things that has helped increase her weight. Also hypersomnia. She has trouble getting out of bed in the morning, even though she makes herself get out of bed and she is able to function in her normal capacity. And then loss of energy. She just feels spent at the end of the day, and she just struggles to make it through her day. The treatment plan that I recommend for her was narrative therapy, where she would meet with me for 1-hour sessions every 2 weeks for 3 months, in addition to the medicine that her physician would prescribe, of course. Goal of the treatment is to find out who she is without depression, basically finding ways for her to cope with stress and challenges. Looking through narrative therapy, we'd be looking at who she was before depression hit her. And so kind of centralizing depression, that she's a person with depression and not a depressed person, not to confuse that. But to look at things that were important to her before her depression, how she coped with things, how she dealt with things, basically finding tools for her to use in her future going forward. And the other recommendation is goal therapy. I would recommend a running group And so, but if she's not feeling up to that right at this point in time, the only reason why I said running group is because that was her passion before. But if she's not feeling up to that, I would recommend Celebrate Recovery, which meets every Thursday. So, in addition, if she wanted to do both, that's an idea. The Celebrate Recovery would help her build connections through a supportive Christian atmosphere. Not only is it letting her find and discuss the situations of things that happened to her in the past, maybe that could be causing some issues for her, but also seeing how others are dealing with struggles and challenges in their life and how they deal with it. Sometimes there's success, sometimes there's failures, but in the end, there's a supportive group that's there to help you, and also to see how God wants to be there and be helpful in these situations based with Scripture. And so that would help with her spiritual and social, getting that aspect in, and then the narrative is helping get her tools in place to help her succeed alongside the medicine. And that is all. And we hope the prognosis for that. So 3 months is what I've set for the narrative therapy, because I think by 3 months we should see some improvement, if not possibly, I would say a recovery, but mostly just to see some improvement. If she feels she wants to continue on after the 3 months, we can do so. I would suggest Celebrate Recovery to continue on, just to keep those bonds of seeing how other people are dealing, and looking at other people's problems and how they deal with it as well. That there is some solutions out there that are a lot of times when people are depressed, they focus on just what's in their situation and they forget to see all the different situations that are out there. And so this enables her the opportunity to see different ways to handle her problems, and possibly feel more in control of her life, bring down her stress, even though her stress was mild. But her job, she had mentioned, was very stressful, and maybe different ways for her to handle and deal with those things. All right, thanks. Bye.